Hi everyone, I'm Dr. Alessio Platania and I'm a neuropsychosomatic GP and clinical sexologist based in London. In this video, we're going to talk about chronic stress, what it is, how it affects the whole body, and how it can show up in different symptoms that affect gut issues, fatigue, chronic pain, brain fog, sleep problems, allergies, mood changes, and even sexual difficulties. I will discuss how we diagnose it and what treatments can help. Stress is the normal body response to a stimulus or a threat. During a stress response, the body releases cortisol and adrenaline to prepare the body to fight whatever is causing it. When we are ill, for example, an infection or an injury is causing stress to our body. In the ancient past, something stressful might have been like an encounter with a lion. Nowadays, stress can look like a difficult meeting with a boss at work or an argument with someone close to us, but the body response will be the same as if we encounter a lion. For people with trauma or neurodivergent people, even simpler things like being in a crowded space can be very stressful. In the short term, that stress response is helpful. It keeps us alert and focused to respond to whatever we're facing, either physically or psychologically. But when the stress response lasts too long or is triggered too often, the body can remain stuck in a state of high alert. Over time, it can literally rewire how the nervous system regulates concentration, pain, digestion, fatigue, sleep, mood, and your immune system. So it can become harder to rest, recover, and feel safe. This can make symptoms feel more intense, more frequent, and more difficult to predict. People with chronic stress often experience a mix of physical and psychological symptoms, rather than just one problem. Stress can manifest in different ways across all our organs of the body. Some people notice headaches, muscle tension, chest tightness, fatigue, brain fog, poor sleep, or change in appetite. Others feel irritable, overwhelmed, tearful, or unable to switch off. It can affect the gut-brain axis, causing weight gain, reflux, gastric ulcers, bloating, cramps, constipation, and diarrhea. It can affect the skin and connective tissues, causing autoimmune conditions, allergies, or food intolerances. Chronic stress can also cause widespread pain and conditions like fibromyalgia or POTS, where the autonomic nervous system struggles to regulate heart rate and blood pressure when we are changing position. In some people, stress also affects sexual function, with changes in libido, arousal, pain during sex, and difficulties with erection or orgasm. For neurodivergent people, chronic stress can cause sensory overload, emotional dysregulation, and burnout. For the diagnosis, the assessment starts with listening carefully to your story. I want to understand when the symptoms started, what was happening at the time, what makes them feel better or worse, and how they affect your daily life. There is no single test for stress itself, but we have some indirect measures based on the heart rate variability, what we call HRV. And we want to rule out any medical condition that might explain all the symptoms, like anemia or vitamin deficiencies, thyroid or hormonal problems, leaky gut, and chronic inflammation. The key is to look at the whole picture and not to dismiss symptoms just because tests are normal. Treatment can be lengthy and require multiple steps, depending on which body system is more affected. It should be tailored to the person, because advice that works for one patient may not work for another one. Have a holistic approach, and this can include education, nutritional advice, use of supplements, medications, neuromodulation of the vagus nerve, sleep support, pacing, and referral to the right specialist where needed. I also integrate often mindfulness and somatic therapy because they can help people become less reactive to symptoms and more aware of early signs of stress. Mindfulness is not about pretending symptoms are not real. It's about reconnecting the mind and the body, helping the nervous system reconnect and be more aware improving body awareness, creating greater capacity to recover. And if stress is affecting your sexual function, it is important to talk about that too, because it is very common but also very treatable. The most important message is this: chronic stress is real and it can affect every part of your body. If you are dealing with ongoing gut symptoms, pain, fatigue, sleep problems, sexual difficulties, or burnout, it is worth speaking to a doctor who will take the time to look at the whole picture and help your nervous system recover. Thank you for watching.